A board-certified dermatologist just told me that she sees more skin damage from do-it-yourself treatments than she does from bad med spas. And some of the devices people are using at home should never be sold to consumers in the first place. By the end of this episode, you'll know which DIY treatments are actually safe, which ones can permanently damage your skin, and when you absolutely need professional help instead of a YouTube tutorial. This is part 3 in our 3-part skincare series. So make sure you subscribe so you don't miss the next series. Hi, I'm Dr. Kate D, and I'm back today with Dr. Angela Casey, a board-certified dermatologist and founder of Bright Girl Skincare, who's seen every DIY disaster you can imagine. She's here to tell us what's safe to do at home, what should only be done by professionals, and why some trending DIY treatments are sending people to the ER. So, Angela, thank you so much for being back with me today. This is my
Thank you for bringing me back.
I'm really excited to talk about this topic because it's just, there's so much stuff that's being sold direct to consumer that is super dangerous and crazy. And you can hardly believe that people can get these things in this country, but they do. So
I know it is like, it blows my mind. It's kind of unbelievable. And I think you and I in our practices have probably seen it all. It is a very interesting time.
Yeah, we will totally be telling those stories in this segment. So let's just talk about kitchen DIY skincare right now. So can you tell me about what's trending? What are people doing and that are like causing the worst reactions?
It has really come to the forefront because we are in a day and age where there are so many influencers, sometimes celebrities, that are demonstrating these skincare regimens using common household ingredients that they are applying to their skin.
Mm-hmm.
And in my practice, I had seen all sorts of burns, infections, complications from those seemingly harmless ingredients, which are, again, common household items that we would think, well, that's can only be good for my skin. And the truth is, a lot of them have kind of a neutral benefit. And there is very little, if none, in terms of scientific evidence in the dermatology literature that supports any of these practices that are being really hyped up on social media. So here's a couple examples of what I've seen in my practice. Lemon juice. It's an acidic substance, obviously. So individuals use that with the goal of kind of exfoliating, chemical peeling their skin, and they feel like, oh, lemon juice, that is a natural ingredient. What they don't realize is that lemon juice, well, it was never designed to be applied directly to our skin. There's really no dermatologic benefit that I am aware of. And it can actually cause what's called a phytophotodermatitis, which is a reaction to your skin when you go out in the sun. Individuals on vacation may experience this if they are using lemons or limes in their beer or tropical drink, and that lime juice or lemon juice gets on their skin and they're in the sun, they'll actually get a pretty severe hyperpigmentation. And that's called a phytophotodermatitis. We see it not infrequently in dermatology because people get back from vacation. They're like, oh my gosh, I got this like really weird pigmentation on my skin. Like it happened on vacation, just out of the blue. And they don't make that connection. But we as dermatologists know well about this reaction of that acidic substance causing a sensitivity to the sun. So that's a common one. You do your lemon juice scrub and then you head outside and it can lead to some really, really bad results. So that's a common one that I see. I see a lot of avocado is another big one. And people think like that's going to like nourish and moisturize their skin. The truth is, so avocado is one where I would put that in the neutral category. It's not going to necessarily harm your skin, but it's not really going to offer much benefit. But if you want to mash up an avocado and put it on your skin, it's probably not the worst thing, but there's a lot of better things you can do. Another category of common kitchen items are like exfoliants. So like coffee grounds, sometimes sugar scrubs, salt scrubs. What we've found in the dermatology space is that those can actually be quite abrasive for the skin and can cause microscopic tears in the skin barrier when you're using those really harsh exfoliants. And when you poll most dermatologists, they are going to tell you absolutely steer clear of any sort of physical exfoliant like that.
Right.
So whether it's like the coffee grounds, whether it's the sugar, whether it's like beads within a over the counter like wash, a face wash or body wash of some sort, like there's absolutely no benefit and just a lot more harm than good that can come
The
from
other
those.
thing is those home brushes. Uh,
The dry
yeah,
brushes.
yeah. Well, like the Clarisonic and thing. I
Oh,
mean,
there's yes.
I don't recommend those either. Anything that's mechanical, I generally don't recommend for exfoliation. Yeah, especially because nobody
Yeah.
cleans those brushes either. You know.
No, I mean, yeah, you're setting the stage for a whole host of issues. It's the irritation and sensitivity that comes from the barrier breakdown. It's the
Mhm.
opportunity, just as you mentioned, for pathogenic bacteria, whether it's like the staph
Yeah.
or strep, that can sit normally on our skin in harmony with everything else, but then that can get into the skin and cause an infection. It's setting your skin for exposure to viruses that are just widespread in the environment that we can come into contact at any point. So, yeah, mechanical exfoliation, I think the bottom line for your audience, that's a bad thing. There are so many safer alternatives with chemical exfoliants, things like our alpha hydroxy acids, our retinols and retinoids. They're going to give that
Mhm.
much like gentler. A natural ingredient is allantoin is a good one. It's going to naturally help that skin cell turnover very lightly, like exfoliate your skin, but not in that harsh mechanical manner that we described with those other substances.
So a lot of people think that natural is good and better than anything that's quote unquote unnatural. Can you address that? Why natural doesn't necessarily mean safe?
We know in the dermatology literature, there are a high incidence of allergic reactions to many things that are considered quote unquote natural. So it's really kind of and essential oils are a big culprit. So we know many
Huge.
essential
Yeah.
oils cause skin sensitivities.
I think
And as our
botanicals also like things derived, people think, oh, it's derived from a tree or a flower. It must be good. But those can be
right,
incredibly irritating, right?
they can be. They absolutely can be. I mean, things as simple as, like mango extract and avocado, it can actually be very allergenic in individual. Nut derived ingredients can be very allergenic in individuals. So natural does not always mean better or safer. And that not only means with the ingredients themselves, but also the ingredients that we use to preserve formulation. So there has been this movement that the more synthetic preservatives, like the parabens, are really bad for us. And when you actually break down and look at the literature, you'll find that that's not always the case. I think in your podcast with the founder of Brambleberry, you
Yeah.
got into this a little bit and just about the importance of kind of understanding how each ingredient works, where it's derived from,
Mhm.
what the risks are with alternatives. So when we substitute an alternative preservative for one that's more established, we might grow bacteria or mold or other organisms in our formulation. We don't want to put that on our skin.
Right, right. And in that, we did point out that, parabens are in lots of natural things that you eat, like blueberries. Like, you're eating, if you like blueberries, you're eating parabens. And that's way different from putting it on your skin. So I do think it's kind of funny where people come in like, oh no, they read the labels and they're worried about that. And then they go have their
Mhm.
yogurt and blueberries. But
Yeah, it's a lot. There's a lot of fear mongering, and social media certainly amplifies that. And then you have organizations that are out there preaching about this and
yeah.
scaring the general public. So I'm so glad that we're having the opportunity to sit and talk about it because we can really educate your community in an evidence-based way about why those thoughts can be a little bit of a misconception.
So let's talk about at-home devices because that's the other, giant thing is that, you can buy all these at-home devices that some of which try to do a medical procedure at home, so you like save that money, and others are doing like completely different things. So let's run down the list, shall we? Okay, because I think
Yeah, yeah.
this is awesome. Okay, so when we talked a while ago, we talked about microneedling a lot. So tell me your thoughts on at-home microneedling. So, if you've been listening to the show, you know I've got stories for days about what goes on in med spas. I finally put them all in a book. It's called Med Spa Mayhem. I wrote it because I got tired of hearing about people getting hurt by providers who have no business holding a syringe. You'll read about real patients, real nightmares, but more importantly, you'll know exactly what to look for when you walk into any med spa and what questions to ask. It's part expose, part survival guide, and it might just save your life. Med Spa Mayhem will leave you informed, entertained, and a little shocked at what's really going on behind the business of the aesthetics industry. The link is in the episode description. Read it before you book your next appointment, because beauty should never come at the cost of your safety.
I think that there can be some tremendous danger in at-home microneedling, and I've seen it in my practice. There are a few reasons. First of all, most individuals are not trained in how to properly microneedle the skin.
Yeah.
And you and I know that microneedling is a procedure where we're putting little tiny microscopic punctures into the skin to stimulate collagen production, decrease inflammation, help skin cell turnover, etc. With these at-home devices, so a lot of them are like the microneedling rollers, which are manual.
Right.
And there's no guideline in terms of how hard or how deep or how many passes besides what's in the instructions. But how do you teach somebody to apply like a certain pressure and depth? It might say roll it 4 times over your forehead, but there's going to be just tremendous variation in how an individual interprets that.
It's the thing about those that kill me is there's 2 big things. One is, if you're actually doing real microneedling and you're getting to the right depth in your dermis, so you're having an effect, that would be excruciating to do this at home because it's very, very painful. So if you're doing it and it's not painful, then chances are it is like a big waste of time and money. So one is just, that the pain and needing real controlled anesthetic. But the second thing is those rollers, it's not like, when we do it in a medical office, it's a sterile, brand new tip every single time that's sharp, sterile, there's no bacteria on it. And after one treatment, it's dull, it's contaminated with blood. You're throwing it away in a sharps container carefully, but you're throwing that away and you're starting with a new thing every time. Those rollers, I can't imagine that they're sharp enough even to start, but over time, like they're got to get duller and duller and duller, which would be, 1, useless, 2, painful as all get out. So
absolutely. And like you said, introducing bacteria and all sorts of other things into the skin. The other thing is, are the consumers educated on proper skin preparation? So in the medical setting, as you mentioned, we are doing a very specific regimen of how we clean the skin, and we're using some alcohol, acetone, making sure that everything that we have is sterile of this environment as possible. Whereas at home, maybe you're washing your face, like maybe you're getting it clean enough, but probably not going through all of those protocols like we do in office. So there's just tremendous variation. And, as a result of improper treatment, you can get everything from hyperpigmentation to scarring to infections to skin irritation. So it just opens a whole can of worms.
Yeah.
I'm not a fan.
I'm not a fan either. So big thumbs down on home microneedling. There's no way. Let's talk about at-home LED devices because those are incredibly popular. So let's just cover first like why LED actually does anything and what circumstances do you need for it to be effective, and then let's talk about the at-home devices. So
there's a lot of evidence. So LED has been around for a long time, many decades. It has recently come back into vogue because now there are a lot of at-home devices which previously were not available to the general public. And with those at-home devices, you're seeing a lot of influencers, a lot of dermatologists that are on social media as celebrities that are putting that LED mask on and or maybe sitting in front of an LED panel. So LED, there's a lot of evidence about how red light helps with stimulating collagen production, decreasing inflammation in our skin, helping to promote circulation. So these are all good things and well established. I don't think anybody's going to argue that. The issue with the at-home devices is just the variability in efficacy. So many of them have not undergone full clinical studies to objectively evaluate their safety. Many of them have very specific guidelines of like having it a certain distance from the skin for a certain amount of time to see any clinical effect, and that you have to use it for 10 or 15 or 20 minutes every day, depending on the device. So compliance becomes a big thing. You have a lot of individuals that might use it here or there, but they're not going to see a big dramatic improvement. I would advise individuals who are looking at these devices, invest your money in an in-office procedure, whether that's a laser or light-based device. You're going to get like it's that old saying, you get what you pay for. You are just not going to get that same degree of results from a product that can be purchased for in-home use for several $100s as you're going to get for it with an in-office procedure.
Yeah. I mean, you're going to get as far as like collagen per dollar. Okay. So if you do one of those collagen generating procedures in office, you're going to get many orders of magnitude more collagen out of that than you will from doing, LED every day. So my understanding is like the one thing that at home might actually be effective if you used it properly and consistently would be one of those masks, because the light actually has to be right up against, within a centimeter of your skin. And you have to do it every day. And you have to do it, 15 to 20 minutes every day, right? For it to have a collagen stimulating effect. And again, even that's going to be minimal compared to anything you would do in office, right? The ones that I think are laughable, and when these came out a few years ago or more than that, they were charging thousands of dollars but there was like a little handheld one that you would wave as a wand that had like a bunch of them in a little head like this big, that big. Those are ridiculous. I mean, is that, you agree? Like
100%, you're not getting close enough to the skin. There's not the consistency there. Like that is just like complete fluff of like, well, I feel like I need to be doing something to stimulate hair growth or stimulate collagen production. So I'm just going to wave this wand around, but you're not going to hold it in a place for 15 minutes and at the right distance. And then you're having to move it to 10 different spots to cover your whole face. It's just not practical.
I think those are just so funny. And I know I know somebody who's very, very interested in all of what we do in anti-aging. And she had just bought one of those for like $3,500. And I was just like, okay, see if you can get your money back on that. That's insane.
That's a big investment. At least a lot of the masks are more in that like $500 to $600 range.
Yes.
So I mean, that's if you really want to do something, that's where I would put my money in that. But I would always go back to the in-office procedures where you're going to get a lot more bang for your buck.
If you are going to use one of those masks, you got to work it into your daily routine. Maybe you do a 20-minute meditation every day. If you already do that, maybe you can put the mask on and do your meditation. I don't know, but one of those things for me, like, what do I tell people I recommend it? No, because I just don't think that anyone's really compliant with that kind of thing. You start out kind of gung-ho, but after a few days, it's like, oh, I don't have time today. You're going out or whatever. I mean, it's really hard to be consistent with that at all.
Yeah, it's a pretty big lift to implement that. And I think it says a lot when you and I do not have these devices in our and you and I can get them for free from the companies that make them if we wanted them, but I don't want it. It would just be another thing sitting in my bedroom that I probably wouldn't use because I rarely have an extra 20 minutes of doing nothing in my day.
Well, so that brings us to another thing that we could both have if we wanted, but we don't, is home IPL for hair removal. Can we talk a little bit about that? Because that also I feel is equally ridiculous. But tell me, do you think they work at all?
So, okay, here's the thing. I think it's important to first of all, a lot of these are marketed as like laser hair removal device, and it's
Yeah.
important to distinguish for your community the difference between laser and light-based energy sources, right? So, laser stands for light amplifies stimulation emission of radiation. So, a laser is by far the most powerful device that we have for hair removal on the market, and we have a lot of evidence. We have specific laser wavelengths based on skin type. So an individual with fair skin versus somebody with darker skin, and what's safe with certain laser wavelengths and devices. So that's one thing. That at home, nobody has access to an at home laser, because the lasers we use for laser hair
Right.
removal cost tens of thousands, if not hundreds of thousands of dollars.
I say
And
a couple
you have to have
$100,000 is what mine cost. So,
yeah,
yeah.
and you have to have in most states at least a nursing license, if not a medical license, to operate some of those devices. So, a
And what to
nursing
keep in
license.
mind, since that's very much important for this podcast, is that nurse can't do it on her own. Okay. Even though a nurse might be able to operate it in certain states, they cannot decide to do laser on any person. Nurses are not allowed to practice medicine. That's practicing medicine without a license. So just because in certain states you're allowed to operate it doesn't mean you can do that willy-nilly on anybody you want.
That's a
So
really good point. Have
yeah.
physician oversight. So, but it just coming back to the discussion of at-home device, like those that degree, that type of device machine is not going to be available to the general public. IPL, intense pulse light, is a light-based device, so very different from a laser, even though many people, I think, in the general public use those terms interchangeably, or they
Wow.
think IPL is a laser.
And a
It's
lot of
not.
places that offer laser hair removal, or call it that, are actually using an IPL device. Even so, it's not
They
even
are.
a laser. Yeah.
Yeah, possibly with a filter to help to narrow that spectrum of the light energy to make it a little bit more applicable to hair removal, or not. Maybe they're just using the kind of catch-all setting for the IPL. So IPL, as you know, much less specific for a target compared to laser. It's never going to match the specificity and accuracy as a laser. Individuals who have really fair skin and very dark hair might note some benefit from an at-home light device, like an IPL, but it's going to require many more treatments. It's not going to be as strong as what you're going to get in office. And my concern with the at-home laser, or the at-home hair removal devices, is individuals with darker skin types that can get some really severe side effects: the hyperpigmentation, scarring, burns,
Yeah.
etc., because their skin is really not equipped to handle that light energy. And because of the melanin in their skin, it sets them up for a whole host of complications.
Right. Are any of those at-home IPL devices, like, are those actually FDA approved? Or are they just being sold directly from China? I mean,
There are some on the market that are FDA approved, but there is a whole. It's much like other devices, like the plasma pens, which I think we'll get into. Like there are, and with microneedling devices, there are some that are FDA approved, and then there's a large majority of them that have not undergone FDA approval, unless you know differently. But
no, I
that's my
didn't know that. I
understanding.
actually didn't even know that any of those at-home ones were actually FDA approved, because I personally think they're quite dangerous. I think having the medical judgment to know who's at risk for complications from IPL, you're not going to know at home. And even a lot of people who do IPL in offices across the country, probably illegally, they don't know either. Like, I think that they're busy damaging, burning people. Like, and so I really think that using these IPL devices is super dangerous, and I would not do that. And I don't think they're particularly effective. IPL in general, you can get rid of some hair with IPL if it's strong enough, and if it's filtered properly. I just don't think these at-home devices do that.
Yeah, I think it's just important to educate the audience. What is the gold standard in terms of laser hair removal, or other hair removal devices? And it's always going to come back to the lasers that, again, are only available in office of a credentialed facility with physician oversight.
Okay, so that brings me to something I know nothing about, and that is gua sha. Tell me about gua sha and what people are doing at home and what your
Yeah, so
recommendations are around that.
well, I would say on the spectrum of things we're talking about, this is one that's a little bit more on the benign side, but I get a lot of questions about it in my practice. There is a ton of gua sha happening on social media. So a lot of my younger demographic will ask me about it. So gua sha is the use of like a stone. So many times it's like a jade stone, like it's a smooth stone that has smooth edges all the way around, and individuals use it to massage their skin. So it's kind of a tool to help with lymphatic massage
Ah,
of the
okay.
skin. So most of the time, like pretty benign, and you're not puncturing the skin. There's no sharp edges. There's no injection. There's no light energy. The issues I've seen with gua sha is, again, the variability in user application. So how much pressure are you using? How many times are you going over an area? And I have seen some individuals with bruising, kind of broken capillaries, and skin irritation from
Mm,
using the gua sha. Many
okay.
times it's used with a skin oil or a glide, but again, just depending on what you use there, it can be irritating to the skin. But in general, I think lymphatic massages, we talk about home based treatments, that's going to be like more on the harmless side. We're not going to
Mm,
see as many complications. And I am a big fan of lymphatic massage in general, but I think you have to have the right tools. Ideally, you're having it done by an esthetician that's trained in that and has a little bit more knowledge of the skin properties, structure, and function, and also just how those lymphatics run in your
mhm.
face.
Yeah. There's a very specific pattern and protocol. We do a little bit of that with we have a hydrofacial and we have that as part of one of our hydrofacial services. And then there is training that goes into that. It's not like massively extensive, but there is it's important. But yes, I would say probably not a lot of harm is done with that. Are you aware of these kind of at-home vacuum pore sucking devices and what those do? I just had a friend last night tell me about a really horrendous experience where her daughter picked up one of these off the internet and it was like all like a Chinese product that all the instructions were in Chinese, so she didn't really know how to use it. And then she ended up completely bruising half her nose.
So I don't have experience with them myself, and I have to say I don't think I've had a patient that has used them. But
Mhm.
just like any device where you are harshly mechanically manipulating your skin, you are potentially setting yourself up for some significant side effects. Not always. Some people might use that and get away with it, but my questions are, how has this device been studied? How strong is that pressure and suction? And the fact that she was getting bruising makes me think it's something almost akin to like when you get a massage and you have cupping done, which is not
Yes.
like the worst thing for you. I mean, it's good. I mean, I had cupping done, and I'm a fan of that. But like, what are you setting your skin up for? In general, with skin on our face, especially, it's not great to like have a procedure like that at home that's causing like damage and bruising at the level of like the dermal blood vessels, which is, it sounds like what's happening here.
Yeah.
So without having more specifics on like the pressure of the suction and the application, I would say thumbs down on that one.
And then one more sort of in our intermediate list here is chemical peels at home. Are there any chemical peels that are safe to do at home and which ones to avoid?
Yeah, I think that there are many chemical peels that are safe to do at home. The large majority of them that are available on the market that you can just get at a beauty store or a drugstore are not, because of the FDA regulations, like they're not going to allow really strong concentrations of chemical peels to be available. So you think of like lactic acid, glycolic acid, salicylic acid based products. And I would say the large majority of those are generally going to be okay. Like anything, you have to be careful what you're using it with, if you're layering it with anything else, how often you're using these things. But I'm not strongly opposed to them. My preference, though, is that individuals go into a licensed med spa or dermatology office where there is an esthetician who is trained specifically on administering chemical peels and can really tailor it to the needs of the individual patient.
Where I've seen this be a problem is where people are using a pretty strong at-home peel and we don't know about it, and they come in for a procedure. So then they haven't really told, oh yeah, by the way, every other day I'm doing, and then their skin can be a lot more sensitive, depending, even just to the topical anesthetic we use. I've seen that happen where their skin's hugely sensitive to the topical because they just did a peel at home and we didn't know. So I would say those are in the medium category. Like you can go astray with those for sure.
Well, it's just an important point to always educate your anybody doing your treatment. If you're going to get your eyebrows waxed or your lip waxed, like you definitely do not want to be doing a chemical peel a day or two before that. You have to educate, like anytime you're having a procedure like that, you have to educate the provider on, I just did a chemical peel, or I'm using a retinoid or a retinol on my skin, or I'm using vitamin C. It's really, I think too often individuals don't advocate for themselves or don't think to mention those
I don't think it's
skincare.
important. Yeah.
Yeah, it's just skincare.
Then they get their brows waxed and you get that red streak under there. That's not attractive. Kind of sad.
No, it's not fun.
So let's just talk about the super crazy dangerous ones. Okay. So I would say that the absolute worst home device that I've seen a complication from is that hyaluron pen, or there are these filler pens that come out of China. These are totally illegal, by the way. These should not, I don't even know how they're getting into the country, but where you can self-administer filler. Let's talk about that. I spend my days making sure people don't fall for fake Botox and unlicensed injectors. So yeah, I care about what products you're using. Bright Girl is skincare for young people created by my friend, Dr. Angela Casey. She's a double board certified dermatologist and mom who wanted something clean and effective for her own daughters. Here's what I like. It's formulated by someone who looks at skin cells under the microscope and knows what she's talking about. No hype, no influencer nonsense, just great products that teach good habits early. So if you've got young people in your life starting their skincare journey, send them to brightgirl.com. Use code DrKate20 for 20% off through January. This holiday season, give something that they will love that actually works.
Yeah, generally not a good idea to be injecting things into our skin that we're not 100% sure where they came from. So that's a good example. There are like hyaluronic acid-based like injectable fillers that just come in like a bottle that individuals will draw up into their own syringes.
Oh my God, that's scary.
So and I've seen it in my practice, like a hyaluronic acid serum that's designed just for topical use. I had a patient once that was drawing that up into a needle and injecting it into her cheeks to give her a little bit. And she had a terrible, like not only infection, but like kind of granulomatous reaction. Yeah, we got her through it without any permanent scarring, but she had some like hyperpigmentation, and kind of temporary scarring that took, oh gosh, I think almost a year to resolve. So anything, I mean, there is a reason why injectable procedures should always be done in office. It is
not only that, but in office by an expert. Like there are a lot of people doing this, charging money to others, and who really have no business doing it either. They don't know anatomy. They might be using these illegal products too. I mean, so first of all, the problem with filler, there are a lot of problems with filler, but if you get it into a blood vessel and block that blood vessel, you will block it and no blood flow will happen. And you could kill a portion of your skin or your nose or your tissue. You can even go blind if it goes in the wrong place. And so you can't do this to yourself. Just don't do it.
No. And to your point, if you don't know what's in that pen or the substance that you're injecting, even if you come in to see an expert like ourselves who we know how to manage a filler complication from common fillers, depending on what in the world was in that injected substance, like we may or may not have the tools to actually correct that.
Yeah. I mean, we had one person come in to our place who had bought one of these pens, and she was trying to inject herself, and she gave herself an occlusion. When she came into us, she had no blood flow to her nose, which is a super sensitive area of your body to get blood flow to. And luckily, we treated it with what we had, which is the enzyme that breaks down HA fillers, and it worked. So at least that stuff, which the label was in Chinese, so we didn't know for sure until it dissolved and it worked. We could fix it, but so incredibly dangerous. Okay, I would put that as number one, as do not go near that thing. But here's, in my mind, number two: plasma pens and fibroblast devices. So, which is the same thing, really. So, have you seen any of those? Because people can buy those at home. And then the other crazy thing is, like, estheticians or other people can buy them off the internet and start doing this it's a medical procedure and quite a dangerous one, just on their own, and offer that in their office.
Again, a device that I think there's a large spectrum. There are, just like with microneedling devices, some that are FDA approved, that are, I think that those are really only available in office. I don't even think an esthetician has access to those or has the license. It doesn't mean it's not happening, but that they have the license to utilize those. But the concern comes in, just as you said, particularly with the at-home devices, that you're using kind of like an electrical current that's designed to stimulate the collagen producing cells, but can burn the skin, can cause hyper or hypopigmentation. You're getting trauma to the skin. Do you really know how to operate this device? So I think it's just setting the stage for a lot of dangerous reactions.
Yeah, it's hugely dangerous. I personally don't think that anyone should be using. I don't think they're safe. I think that it depends on the operator knowing all the settings and then pressing just the right amount of pressure and time to get the right amount of damage, but not too much. And any little dots, like all these little dots on the skin, and any one of these little dots could penetrate too deep and cause scarring, hyperpigmentation, hypopigmentation, infection. I mean, it's terrible. So I actually don't think those should be used at all. I mean, I know there are a lot of offices that like it, and I think that they're super dangerous.
So there's a lot of room for user error with these, as opposed to there are so many safer alternatives that are a little bit more standardized. Like when you put in the settings and you adjust, like with microneedling, the depth and the speed, or with lasers where you're adjusting the dwell time and the spacing of, say, like a fractional resurfacing laser. But you can put that in and it's going to kind of standardize the procedure, as opposed to having that dependence, like you said, on the operator and how much pressure and how deeply they're applying it in any given location.
What do you think people should do if they already have some of these devices we've listed? I mean, I wouldn't even sell them to someone else. Maybe sell them to your worst enemy, but besides that, I'd throw them away.
Yeah, I just it's just often not worth the risk, and the complications. And I mean, if you do have a complication, you will go back and just regret the day that you used it. So it's just one of those things where, like, I just wouldn't go down that path. I would recommend seeing, again, an experienced provider, a licensed provider, making sure you do your homework on every individual if you're going to a med spa or a dermatology practice, and just making sure they have the right credentials and experience.
Absolutely. I mean, there are so many questions you need to ask to guarantee that that place and the providers in the place are qualified to do what they're doing. And again, just a little plug for the Med Spa board. That is why we're about to roll out. Actually, by the time this is posted, we will be live for sure, because we're just on the verge of finalizing the website. But we're going to do all that work for you. So hopefully right now you have to ask all the questions. Who's the medical director? What's their degree? Are they involved? Who's the provider? Look up their license, all of that. Make sure they're using legit products. But ultimately, hopefully very soon, we will have this certification so that we will be able to answer all those questions. And so that if you know it's certified, you don't have to ask so quick. It doesn't mean that they're going to provide the results you want. That's another story. That's a whole other layer. We can't guarantee anybody's results, but
It's just tremendous that you undertaken this.
yeah.
It's a big undertaking, but it will change the trajectory of the health and wellness space for decades to come. So it's super exciting, and I commend you for leading this movement. It's really important.
Thanks so much. So if in the last question I want to ask you is like, besides a really great skincare regimen at home, which we've already talked about in our first episode in this series of 3, like, is there anything else that, people should be doing at home, or should they just be coming to someone like you or me for all of these kind of bigger, results procedures?
So there's a lot they can do at home with their skincare regimens, but I think getting proper guidance from an expert, and that doesn't mean having to go see a physician for that. It can be even an esthetician who's well trained in that space, or an APP, an advanced practice provider, but just getting guidance on the right tools and ingredients to implement. So I think that's one thing that we can really implement, these basic, simple habits into our day that are going to support our healthiest skin and getting on the right skincare regimen. And if it seems too good to be true, it probably is. If you're getting your advice from an influencer or a celebrity, that's probably not the best resource to use. And we are lucky to be in a day and age too, where we have a lot of experts, like board certified dermatologists, providers like yourself, Dr. D, that are getting out there to dispel a lot of those myths. So take advantage of those resources if you don't have immediate access to an expert.
Yeah. And if you've already damaged your skin from one of these devices, like, go see a board certified dermatologist and try to fix it right away. Don't try to treat it at home, and don't try more DIY treatments for that. It's really important to make sure you don't end up with scarring or permanent pigment problem.
Yeah, absolutely.
Well, Angela, thank you so much. I think all 3 of these sessions have been so interesting, and I know I've learned a lot. Hopefully our audience has learned a lot, and I really appreciate your talking with me today.
Oh, it's been an absolute honor and pleasure. Thank you so much, Dr. D.
Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.